And again, this idea of, yes, accessibility by many and equity. And, we have all these great efforts and goals to try to diversify the profession and the industry. Now, what is this going to do to help us move forward in making things more equitable for people that want to get into this profession to be able to achieve the academic and the clinical requirements to get in the door? That's just kind of all the things that mull around in my head that are not at all easy discussions. And I will say the May board meeting that, is typically board orientation, committee activities, is all clear for 2.5 days of kind of broad strategic discussion around just these things. How is this disruption to the clinical world going to affect the eligibility, the certification pathways? What does it do for our efforts to diversify our membership? The fact that our volunteers are not as accessible to do the bulk of the work that the association relies on them to do. I mean, it's a big impact in a lot of places. So I'm going on and on, but I know that you have been a strong advocate, and we're grateful for that, for those that are not necessarily in a financial position or in any, equal playing field, to try and gain access to the resources or to the education and the financial resources in order to do a clinical requirement or the clinical hours. And we appreciate that level of advocacy to help us see the blind spots in where are we not considering that. In order to access that, you would have to have access to high-speed internet or, a computer, a laptop. Even though virtual classrooms now exist, that still requires, again, the resources, the computer, a laptop. All of that definitely goes into play in how we consider the context for why this profession continues to be homogenous in its composition. White, middle-aged, female. Yes, yeah.
Hello.
Well, and you and your Bank Street colleagues have been great in engaging the ACLP leadership and your colleagues in creative ways in which to think outside of all the things that have come before us that have kind of kept us homogenous, to see where we can expand, the ways in which we should expand. So all of that has been very helpful. But I digress. I welcome you to share anything else about the personal impact of this coronavirus environment, your concerns for the industry, your concerns for the peers, or your celebrations. I have started to feel like, okay, there are some silver linings in that. I have learned that I love to color and to do puzzles with the girls. Yes.
Not a puzzle.
Oh, no? Yes. My 6-year-old and I have learned that we love doing puzzles together, except for when you get to the end and there's a piece missing and it's like,
oh no, that's the worst. Oh, God.
It loses the entire soothing, comforting feeling. But anything that comes top of mind about what you would like your colleagues to know or the public to know about this current state of affairs?
Oh gosh, that's a big question.
I know it's a big question.
I think just to sort of talk more personally about it, what's hard for me is that I worked in a hospital. So I have this sense of this sort of vision of what it must be like in these settings, or what professionals and my colleagues and people I worked with or still do connect with personally and professionally, what their experiences must be like. And I've, there's a part of me that's like, oh, there's like this guilt of like, I'm so glad I don't have to do that. But then there's another part of me, just because of who I am, that's like, oh, I wish I was there because I want to do something. I'm a doer. I'm somebody who actively needs to be doing something. And it's hard to remind myself that the best thing I can do right now is to stay in my home. It's a very passive doing. But in that, I'm like most child life specialists, a bit of a creative. And so I try to do stuff that I think will benefit the greater good. And so I put out my DIY video about coronavirus. I connect with other people trying to figure out what are ways that I can share what I have, what I do. So, Child Life Disaster Relief took my homemade bingo board and turned it into this beautiful board, which they posted on their site. And I was at the Wonders and Worries virtual presentation they gave the other day, and heard one of them say that they only had one medical doll with the portacath in it for working with their patients virtually. And I sent a directions and a video on here's how to make your own with your garbage from home. So like I try to think about what are the ways in which I can support those that are doing the work. I think so much of what we do is to recognize when you're the frontline person and when you're the person that's holding up the front line. So to me, I feel like right now I'm holding up the front line. So I figure out the ways in which I can support those that are doing the work. I'm making donations to the food banks that also serve healthcare workers and the restaurants in those communities. Looking for just ways that I can continue to reach out, connect with, support those who are on that front line. And that makes me feel like I'm doing something worthwhile during this.
You absolutely are.
Yeah. And I'm fortunate that thank God, my children are middle school and high school, because if I had to be the teacher at home, I would be going crazy. I like to say I'm an excellent child life specialist. I'm a mediocre parent.
I like that. Yes, I love hearing that. I will say I am with my 9 and 6-year-old. Yes, we are officially on spring break this week. But next week starts the virtual learning. It's like, well, here comes the next round of learning and opportunities. Being parents right now. But I want to continue applauding you because you certainly are holding in the front line and everything that you're doing for your community, but also your peers. I know brings comfort and support, which is the cornerstone, of the profession, is really the sense of community and connecting and support and advocacy. And you do it all, and you do it graciously and seamlessly. And we just appreciate all of it. So thank you for continuing to serve in many ways. Well, I'm going to cut off this recording because I talk all the time. But I just want to thank you for taking some time out of your day to share yourself with me and our audience. And we'll remain in touch, remain in contact to see what else we can do together for the industry and move ahead. So thank you.
Thank you. Thank you for giving me this opportunity to share with you.